Hello, and welcome to the inaugural episode of the Buena Vista Project, a podcast about Mexican American history, politics, cultura, y más, coming to you from San Antonio, the Mexican American capital of the United States. I'm your co-host, Elaine Ayala.
And I'm your co-host, Michael Quintanilla. Thanks for joining us. On this first episode, we'd like to introduce the Buena Vista Project and what it will strive to do. It will amplify the voices that shape our streets and stages, from tamaleras to trailblazers, muralists to movie makers, and activists to abuelitas.
Each podcast and narrative, because we're longtime newspaper writers, will reside on our website and will stream on YouTube and other streaming services. Each episode will explore the richness of our culture, blending a deep reverence for tradition with a sharp eye on current events.
The Buena Vista Project is a news archive in real time, a front row seat to San Antonio's soul, a mic shared with activists self-trained as policymakers and economists, because that's how we see them, to politicians serving as diplomats and changemakers who are ambassadors among us. Together, we are writing and rewriting the great San Antonio narrative.
And our first guest is former City Councilwoman Adriana Rocha Garcia, the new president and CEO of the Center for
Empowerment.
The Center for Health Empowerment in South Texas, or CHEST, a nonprofit dedicated to improving health equity and bridging the gap in healthcare access on the southern end of San Antonio. It's an area designated as medically underserved. Welcome and congratulations, Adriana.
Gracias. I'm so excited to be here as your inaugural guest. And I gotta say, what incredible style you've got going on today. I mean, look at your shirts and
Outside.
Il mero hueso.
I love it. Well, listen, I live in the southwest part of town, so I know. I'm right in there, so yes.
Thank you for being here. Now, your logo looks a lot like a talavera tile. Tell us that story.
Yeah, so we wanted to incorporate a little bit of the history. When we are very proud to be able to say that we are serving an area of town that has long been overlooked. And the reason that we chose the talavera tile is because people think of tile and immediately they associate it maybe with azulejo, common in Mexico. They forget also that Talavera de la Reina in Spain was where the original name of the Talavera tile came up. However, what they may not know is that Talavera was associated with the wealthy originally. And the blue, the hues, it was more expensive to create in blue. And so the more blue you had, más azulejo, más tenías dinero, ¿verdad? That's the association. Yeah, so
it's like a diamond or something like that.
Yes, and so we didn't want to have that because we want to make sure that health is accessible to everyone, no matter what level. And so we chose the colors pink and orange, not because Adriana likes pink and orange, but because pink resembles compassion and orange is action. So in essence, it's compassion in action.
And orange is the color of healing.
That's right.
Yes.
Absolutely. And so there's so many synergies. And so thank you for the nice shout out in the center. You see also a keyhole. And the T, when we have it as an acronym, the T actually has a key. So you can
see
there. Yes. Yeah.
One of the first questions I have is the geography of your goal. Because you talk about the southern end of the city, but some people might just think, oh, you're only focusing on the south side.
So we're not. The beauty of it is that we said South Texas. And so eventually we also want to help South Texas because we know that people who live in South Texas, they come for help in San Antonio for their healthcare needs. And so, but we have to start somewhere. And we figured that we'd start in the south side of San Antonio. Our chair, Dr. Lisa Ochoa, has been instrumental already in getting some students access to patients on the south side so that they could know, they could understand the needs residents of the south side, but we eventually want to expand also to the west side, to the east side, and like I said, South Texas eventually, which has very many underserved people and underinsured. And so if we think about maybe the city of San Antonio and we divide it in half, the southern section, south of 90, you start seeing these discrepancies. So for instance, we can tell you that the lifespan changes from the southern to the northern part of San Antonio. There's a lifespan gap of 20 years. That's very unfortunate. But also, when we think of staffed hospital beds, at any given time, there are about 100 beds available north of 90 for you to go to. But south of 90, staffed hospital beds are 0.7%. And so we want to help with that as well.
Okay. How did this initiative get started? What was the catalyst?
So I want to say that the catalyst was originally way back when COVID got here.
Okay.
And we saw the disparities associated with the COVID deaths, the access to care, etc. And so a group of us started working together just originally just on healthcare issues. Unfortunately, then a couple of years later, the Southside Hospital that had been there for 40 years, originally Southwest General Hospital, then Texas Vista Medical Center closed. And what that did was put an incredible stress on the residents of the South Side, because now it takes, on a good traffic day, an extra 12 minutes to get to the nearest hospital. And when you're having a heart attack or another medical emergency, you can't say, wait an extra 30 minutes until traffic calms down. And so that was another reason that we all came together and said we need to do something to help with this.
And we are getting a new hospital.
We are. I'm very excited because University Health has designated Palo Alto hospital that's going to be on the south side. There's also going to be a public health building, essentially, that we hope we will have access to as well with various nonprofits, so that we could convene, brainstorm about health disparities, and more importantly, how to bridge those health disparities or get rid of them altogether.
So tell us the plan for CHEST. Where do you start? Your goals sound, I have to tell you, overwhelming.
Yes. And so we have to start somewhere is the reason that we said we absolutely have to focus somewhere. And so we decided on the south part of San Antonio. So there's a focused effort. And what we're doing is we know that this is going to take a long time. Something is not going to change overnight. So what we're looking is for people that are willing to say, I believe that this is going to be not only a generational change, but it's going to take 5 to 10 years to see any changes. So how do we get into neighborhoods? How do we imagine in a neighborhood that has access to healthcare? So what we're doing right now is we are hoping to see if we could find a building, possibly a school that had been closed, or another type of building, to lease it or eventually buy it, and bring some services there in general with nonprofits. Sometimes someone might get a diagnosis for something and they might not know where to turn to. We want to have people there that say, this is where you go, this is how you access help, you're not in this alone. And bringing classes, educational resources, something as easy as identifying some of the common reminders, right, that we're looking for as caretakers, for instance, that maybe our loved one might have dementia, Alzheimer's, etc. And so that's the type of programming that we hope to do. It's going to be a little bit at a time. We've applied for a few grants already that we're hoping to get, even to bring access in terms of reminders that things are changing, like the Affordable Health Act or Healthcare Act that's coming. People will have to re-enroll now. Access to healthcare navigators is something that we want to have in terms of resource fairs, etc. One way that we hope to make change is looking, for instance, at when they come in, partnering with doctors, partnering with clinics, etc., to really look at the person as a whole. What else do they need? Do they need access to healthy foods? Do they need access to exercise, etc.? So that's how we hope to do it.
Yeah. So nutrition's a big part of this as well.
Nutrition is definitely a big part of it. One of the goals of CHEST is also to increase the number of students in our area that want to access healthcare in general as a career. So
Oh.
LVNs, RNs, phlebotomists, radiologists, all the way, yes, to physicians, nurses. We want to make sure that kids that live in our area understand, because it's easier for them to be able to understand, for instance, the cultural needs of these areas. We know that for a long time in our communities, we're used to certain things. Like we're used to, for instance, eating tamales, and we're excited about our culture. We're never going to forget our culture. How do we make that a little bit healthier? Or how do we remind people that it's in moderation, that we can still celebrate our culture? And that's why the focus is on creating some additional pathways for students who live in the area to be able to talk to people in their area as a part of a healthcare system.
Excellent.
Although I have to tell you, I made some healthy tamales one time. They didn't fall out of the and that, well, I can't use that word. I was about to say a word I can't use on camera, but it was not good.
Well, and that's, again, in moderation. So it's not every other day or something.
Or not a whole dozen.
That's true. Absolutely. Yes. I noticed that HEB is selling them in half dozens, by the way. And now I mean, they're bigger, but still.
Yeah.
But I have to ask you, tamales, ketchup or no ketchup?
No ketchup for me either. That, Michael.
It must be a me thing.
It's a South Side thing.
South side.
I guess there's my Southwest side.
Okay. Can you describe a family that fits into the chess model? For instance, income, education, family size, things like that.
Yeah, so we know that the families that we are trying to help are usually intergenerational families. It might be families that have abuelito or abuela living with them. And we want to hopefully bridge that, take advantage of the fact that the child is so instrumental. Like, for instance, we know that grandkids are like the heart and soul of grandma and grandpa, right? And so, like, I walked in and my parents are like, ¿Dónde está mi hijo? Right? Like, forget me. And so we want to take advantage of that and have kids empowered to remind their parents and their grandparents that it's important for them to eat vegetables, to eat less tamales, or or just in moderation, etc. And so we that the family that we're going after is that blended family, essentially that Hispanic family who has a child that can and will make a difference in their life because maybe they speak English, they can maybe translate to them. We are really focused in right now on empowering the Quintana neighborhood off of, well, I would say between Laredo Highway and Quintana off of South Cross Road.
That's a corridor. They call it.
That's right. It is.
And it's such a poor area.
Yes, absolutely. And so it's one of our areas that needs a lot of investment. And so imagine being able to take that corridor and making it a health empowerment zone, and reminding people that there is access to services in that area, that San Antonio will not leave them behind. And that's the thing. We're trying to get other San Antonians to come in and realize that a healthy economy for San Antonio means having a healthy workforce. And that means investing in the health of everyone in San Antonio. A lot of companies have people that live on the south side. The headquarters might be on the north side, might be downtown, etc., but their employees live in the south side. So how do we make it accessible for them to have that healthy food, that nutrition, etc.?
We hope you can find that building in that area so that it will begin right away.
Yes, please. Wish us luck. And so I was at a neighborhood association actually it was a Fuerza Unida meeting. And
that's right in there.
Petra and Viola.
And so a few of the ladies raised their hands and they were like, oh, there's some South San ISD schools available.
Oh my God, this will suggest the schools. Yeah.
Yes. Yes, they were so excited about it that this was coming to their part of town. And so, of course, being able to let organizations like them and others use the building for community meetings, etc., that's really building community, and that's what we need.
And to entice a clinic there and
Yeah.
exercise gym and all those other elements that make for healthy living.
Yes, imagine having a yoga or Zumba or even a community.
Michael and I would be there. We need yoga, right, Malaya?
All the time. All the time. I'm thinking, will you also rely on organizations like Fuerza Unida to get the word out? How do you get the word out?
Yes, we're going to be working with different community organizations and inviting them to share with their residents, with their participants, the fact that we have these things going on. So,
Yeah.
for instance, when we have healthcare fairs there, we want these organizations, the churches. By the way, there's 6 churches alone in that area that can help us get the message out. And so it's partnering up with everyone in the community. It's partnering up with the small businesses, inviting them to have flyers so that people could know that they could come check their A1C levels, right? And so things like that. That's what we're envisioning, and we're envisioning it right in the heart of communities across San Antonio.
So, building this ecosystem that supports your goals is hard. Because when you think of the hospitals, they're only in the part of town, largely in the part of town that can afford to go, that have health insurance that will pay. So, describe the ecosystem that you want to build and how it can be affordable.
Well, I'm loving this question, Elaine, because I get to talk about the concept of chest. And when people think of a chest, we want them to think in terms of a medicine chest. Something else that people might not be aware about is that the medicine chest was actually created in the 16th century, gained popularity in the 17th century, but it was only accessible by the wealthy and nobility because they were able to commission these medicine chests with different solutions, if you will, to different illnesses and ills, based on the pharmacist or the doctors would write prescriptions, would have powders, would have scales to be able to measure the powders, etc. And what happened is that in the when we think about what happened in the early days, also we see that the wealthy people were able to essentially save themselves.
Yeah.
We didn't see much of a difference essentially with COVID. And that's because they had access to some of these resources, including in their very own home, right? We know that some medicine chests right now are empty.
Yeah.
Everybody has a medicine chest. They're
That's right.
technically they're built in now to homes, but some of them are empty. They're being used for storage, or they have expired medication, etc. And so we want us to really think of yourself as a part of chest. Even though you might not need the medication yourself, you are a part of the solution. You could be a pharmacist that's bringing to us new ideas. You could be a nutritionist that's bringing with us ideas to maybe not make those tamales so different, right? But a little bit different at least. You could be a university president that is there to focus in on how to create pipeways to the students that I mentioned earlier.
Yeah.
So everybody can be a part of the chest. Everybody is a part of the solution in the community, and that's how we hope to engage everyone.
And we can help build people's medicine chests by donating the kinds of things that go into
That's right.
That's
a
right.
medicine chest, because we have food bank drives and all that. Maybe this is another way we can help out.
Yes, absolutely. And so imagine being able to have access to, for instance, a school building that had been closed down and having perhaps an area, a pantry, if you will, but of medical supplies.
Yes.
Of people that donate, even Band-Aids, something small, right? Where
Peroxide or
absolutely,
cuts or
yeah,
Eosporin
Yes.
or aspirin,
Yeah.
whatever.
absolutely.
Yeah, I love that. Now, earlier you mentioned the 5-10 year
Mhm.
plan or the goal. So, how will you measure your success? What is your 5-year goal? or perhaps even your 10-year goal?
Yeah, and so one of the goals that we have is that access to nutritious food. How many seniors are we able to convince essentially to build some additional eating habits, great eating habits in there by educational classes, etc.? How many partnerships will we be able to achieve within the 5 to 10 years? There's strength in numbers, and everybody is doing incredible work across the city as a nonprofit. Our job is to convene. So that number of partnerships that we create, the number of programs that we serve, and more importantly, maybe even also the number of students that have access to showcasing health education. One of the things that we're doing right now is we're working with SA Smart, and we are going to focus in on some of the social determinants of health during that competition in May. And so those are the type of things that we need to continue to do so that our students are aware of the disparities and so that they could help address them right away.
Mm-hmm.
In case someone from another city is thinking, God, this is what we need to, tell us where they can reach you, your website address,
Yes.
etc.
That is www.chestsatx.org. And there's contact information there, and would love to just talk a little bit more. It's always great to share ideas and to learn from one another in best practices and also in things that don't work out or things that might take a little longer than expected.
Before we let you go, we have to ask the obvious question. And what's your take on the new city council, our new mayor, Jones? How would you assess their progress so far? And if it's not too pinche, can I ask who you voted for?
Look at you. Well, so I voted for my Councilman Edward Munguia.
Oh, okay. All right. Okay, we'll let you go at that.
My new councilman.
That's
My former councilman.
That's right. No, but no, seriously, I think that as in any organization, when a new leader comes in, there's the ability to know that there's going to be growing pains. There's going to be changes in style, in direction, and so it's about learning from one another, learning how to work best with one another. So my advice to city council would be just to learn about each other, learn why each other works a certain way. We were all raised different. We were all experienced different things during our lifetimes that get us to the way we are today. This is the way we are shaped, are the experiences that shape us. So I would say maybe to all of San Antonio, let's give it till the end of the year and let's see, right? So let's see how they adjust.
Maybe Christmas time might bring them together. Maybe Thanksgiving.
That's right. So, and also prende la vela.
Prende la vela, absolutely. Thank you so much for being our first guest. It's such an honor, Adriana, to have you here, and good luck with
You're fine.
everything.
Thank you.
Michael?
Yes. So one last thing. Say a Little Prayer, the romantic comedy filmed in San Antonio, is now available on multiple digital platforms for the first time. So you can see it on Apple TV, Prime Video, YouTube, Google Play, Movies and TV, and Fandango at home. So I say, let's just set up our chalupa bars and enjoy.
Absolutely. Thanks for joining us. We'll be back next week with another episode of the Buena Vista Project.
Until then, hasta la buena vista.